Hair is important to a lot of people, but it means a totally different thing when you have cancer. Is there something that we can do so that people can get treated without losing their hair? So one of the things that people always ask about chemotherapy is, will I lose my hair? And that's a really important question, not just if you're gonna get it back or not. In fact, usually about 90 to 95% of people do get their hair back, and usually it's like thicker and oftentimes curly. But the big thing is, it's what's associated with the hair loss that's obviously can be very difficult emotionally and psychologically. One of the things that I remember most is, when one of my patients told me when they were losing their hair, and it makes sense, a lot of her friends and family were saying, oh, it's just hair and it's gonna grow back, and which it will. But the way she talked about it and how it really wasn't the loss of the hair or the concern it coming back that was the issue, but more so what it stood for and kind of what category she felt like it put her in to be going through that. It was the symbolism of the hair loss. There's a reason that hair is lost with chemotherapy. So chemotherapy, remember, is a very generalized treatment, meaning it's a shotgun approach, right? So in essence, it is a poison to cells. And there was a ton of studies done decades and decades ago where they saw how much poison chemotherapy or cytotoxic can the body tolerate, where it's still safe and the body can recover, but still give enough to destroy the cells that are kind of replicating the fastest. So your hair cells obviously grow fast. Now there are some things that can reduce the chance of losing it. One really popular thing is called the cool cap, and it's unfortunately not insurance covered, but I know that a lot of people are out there lobbying for it to be, again, because of the emotional and psychological burdens, which are just as important in health as medical diagnoses, that comes with chemotherapy. And if you don't have it covered with insurance, which they don't, it can be upwards of $1,000 a treatment. And it's very high maintenance. You got to store it at 32 degrees below 0 Fahrenheit, and you got to start it, 30 minutes before the treatment, and you keep it on for an hour. But if you think about it, the reason that works is, if we told you that chemotherapy is going through your blood and the whole purpose is to kill any few cells that may be left behind after a surgery if you're going for cure, the studies show that people that get chemotherapy in certain categories, even though 100% of them got quote unquote all of the tumor out, that there is a recurrence rate because there's disease we've learned that hangs around that we can't see. You can't see it with your naked eyes, you can't see it with imaging. And when you give chemotherapy, it takes care of that micrometastatic disease. And therefore, those people actually relapse less. That's more of a true fact when it's like stage 3. So something that's not stage 4 spread somewhere else, but got pretty big or quote unquote locally advanced. Those are the people that really benefit from chemotherapy after having a curative approach when they take it out. But when you're giving chemotherapy, it's going in your blood system head to toe. Well, when you put on a cool cap, what you're doing is you're shrinking all the blood vessels in your scalp. So what happens? If the delivery of blood to your scalp and hair is much smaller, if those blood vessels shut down and get really tight because they're freezing, then the delivery of that chemotherapy to those follicles is less. And therefore, you have a better chance of not having the chemotherapy affect your hair. Other things that you can do are basically the same thing you do for hair loss normally. Minoxidil, right? Rogaine, they use that to keep hair on their head. I've been using that for years. And it shows that it does bring back hair about 4 weeks sooner for patients that got chemotherapy. You can also use what they call finasteride, or other people know it as Propecia, and that can help retain it sooner as well. Other things that do help hair growth are basically the same stuff that helps nail growth, because they're essentially both the same thing. Dead cells that you're sloughing off that have somehow become cosmetically very relevant. So vitamin E, vitamin C, those both help, as well as even biotin can help protect those things and kind of make them healthier. So some people might, in conclusion, think, well, hair is just hair, or these kind of smaller things aren't really that important in the big scheme of treating cancer. But the truth is, they are. We all have, a finite amount of time on Earth. We're all trying to live the longest that we can. But that time and how you feel during that time is really important. So where these trials and treatments really help for people to live longer with cancer, they can also really relieve the burden and kind of the emotions that come with something that's really debilitating and tough to get through. So it's with trials and with all of us like learning about these things and exploring way more even literally newer mind-blowing options, no pun intended, when it comes to like preserving your hair and having less side effects and toxicities from cancer, that we're going to explore, as well as places with artificial intelligence and companies that are helping to move cancer forward in precision and targeted therapy. My name is Dr. Sanjay Juneja. It's been an honor to talk to you about all this stuff during my haircut. This is Mr. Jeff Bates. He's been taking care of me for a very long time, and we hope to see you on the next episode. You've made it through this video and I am super stoked. Hopefully you feel a lot more knowledgeable and even somewhat comfortable about the crazy world of cancer. If you did, like, comment, but especially just share, if nothing else, to get this information out so that hopefully people are less intimidated by something that's as scary as cancer would be a big win. And we look forward to seeing you here next time.